Walter was 71, healthy, active. He slept 8 hours a night, every night, in the same position he had slept in since he was a boy. Flat on his back, head on a flat pillow, hands folded across his chest. He woke up one Tuesday morning and could not move the left side of his face. By the time the ambulance reached him, he had lost the use of his left arm. By the time he reached the hospital, he had lost most of his speech. The neurologist told his wife it was a stroke. They had caught it within the window. Walter would survive, but he would never sleep the same way again. Because what nobody had told Walter, what nobody had told his wife, was that the position he had been sleeping in for 50 years, perfectly comfortable, perfectly familiar, perfectly normal looking, was the single sleeping position the medical literature most consistently links to nighttime stroke and cardiovascular events in adults over 60. For decades, sleeping flat on your back has been considered the default, the natural position, the way humans are supposed to sleep. The truth is far more complicated, and in a body over 60, the truth can be the difference between waking up the same person you went to bed as and waking up to a phone call to 911. In this video, I'm going to walk you through 5 sleeping positions ranked by how dangerous they are for the aging cardiovascular system. I'll explain exactly what each one does to your blood flow, your blood pressure, your oxygen levels, and your nervous system overnight. By the end, you will know which positions to avoid, which one to switch to tonight, and 3 simple adjustments that, according to the data, can meaningfully lower your nighttime stroke risk. Stay with me through position number 3, because that is the one almost no one warns seniors about. And position number 1 is the one Walter was sleeping in, the one that, in the most rigorous studies we have, has been associated with up to 3 times the risk of certain nighttime cardiovascular events compared to the safest position. My name is Dr. Goodman. On this channel, I take what the medical literature on senior health actually says and translate it into plain language you can use. If you haven't subscribed yet, I genuinely appreciate it. Before we get to position 5, drop a comment below and tell me, which position do you currently sleep in? Back, right side, left side, stomach, curled up? I read every comment, and the patterns you share help me see what this community is actually navigating. Now, before we count down, you need one concept. Sleep is not the same biologically as resting on the couch. When you lie down to sleep, 6 physiological systems shift simultaneously. Your blood pressure begins to drop. Your heart rate slows. Your blood vessels dilate. Your breathing becomes shallower. The fluid in your body redistributes. And your spinal cord, which controls all of this, communicates differently with your organs depending on the position of your body. The position you choose decides whether those 6 systems work in harmony or whether they fight each other for the next 8 hours. In a younger body, the systems are forgiving. In a body over 60, with stiffer arteries, with a heart that pumps a little harder, with a brain whose blood vessels are slightly more narrowed than they used to be, position matters. Here are the 5 sleeping positions, ranked from least to most dangerous in the aging cardiovascular system. We're counting down. Position number 5, stomach sleeping, the prone position. Stomach sleeping is the position most adults outgrow naturally by middle age. After 60, less than 7% of adults still sleep this way. There is a reason your body has been quietly steering you away from it. When you sleep on your stomach, your neck is rotated, usually to one side, for hours. That rotation kinks the vertebral arteries, the small arteries that travel up the back of your neck and supply the back of your brain, including the parts that control balance, vision, and coordination. In a senior with any degree of arterial narrowing, repeated nightly compression of those arteries can contribute to reduced cerebral blood flow. Stomach sleeping also compresses your diaphragm against the mattress. Breathing becomes shallower. Oxygen saturation drops slightly. The heart works harder to maintain output. And finally, the position increases pressure on your lower back and abdominal organs, which can worsen acid reflux and put pressure on the bladder. If you sleep on your stomach now, this is the easiest position to retrain out of. A small body pillow held in front of your chest will keep you from rolling forward. Within a few weeks, your body will adjust. Position number 4, sleeping on your right side. This one surprises people because the right side feels just as natural as the left, and for many seniors, it is a perfectly acceptable position. But there are specific situations where right side sleeping creates problems that left side sleeping does not. Here's why. Your stomach sits slightly on the left side of your body. When you lie on your right side, gravity pulls stomach acid toward the upper portion of the stomach, the part that connects to your esophagus. The lower esophageal sphincter, which normally keeps acid out of the esophagus, becomes much less effective in this position. Acid reflux at night gets significantly worse. For seniors, that's more than a discomfort issue. Repeated nighttime reflux can stimulate the vagus nerve, which sits right next to the esophagus. Vagal stimulation can trigger irregular heart rhythms in vulnerable individuals. Studies in cardiology journals have documented an increased rate of atrial fibrillation episodes in patients with poorly controlled reflux at night. Right-side sleeping also slightly worsens venous return to the heart, the flow of blood from your body back to the heart, especially in patients with heart failure or chronic kidney disease. The left ventricle, which has to pump against gravity to send blood out to the body, can work harder in this position. For a healthy senior with no reflux and no heart issues, right-side sleeping is fine. For a senior with reflux, with heart failure, with a history of arrhythmia, or with kidney disease, the left side is meaningfully better. Barbara was 67. Had been having episodes of irregular heartbeat at night for over a year. Her cardiologist could not find a clear trigger. When she finally tried sleeping on her left side, on her doctor's suggestion, the episodes decreased by more than 70% within a month. She had not realized that her acid reflux, which she barely noticed, had been quietly setting off her heart rhythm every single night. Position number 3. The one almost nobody warns seniors about. Sleeping with the wrong pillow height. This is not technically a body position, but it changes everything about what your sleeping position actually does to you. And after 60, it becomes critical. If your pillow is too flat, your head tilts backward, your airway narrows, and acid from the stomach can travel upward more easily, especially when you are on your back. If your pillow is too high, your neck is flexed forward like you are looking down at a phone all night long for 8 hours. That forward neck flexion does two things. It puts continuous pressure on the cervical spine, which after 60 is almost always arthritic to some degree. And, far more seriously, it can partially kink the carotid arteries that supply blood to the brain. In a senior with even mild carotid narrowing, that kinking, 8 hours a night, every night, reduces cerebral perfusion. The brain quietly receives less blood than it should. The signs are subtle: morning headaches, mental fog upon waking that takes an hour to clear, a vague sense that you slept long enough but do not feel rested. The fix is simple, and it costs nothing. Your pillow should hold your head and neck in the same alignment as if you were standing up straight. When you lie on your back, your chin should not tip toward your chest, and it should not tip backward toward the ceiling. When you lie on your side, the side of your head should sit on the pillow at the exact same height as the distance from the side of your neck to your shoulder. If you can run 2 fingers between your chin and your chest comfortably while lying on your back, the height is roughly right. If you cannot, your pillow is wrong. Replace it this week. If you're still with me and learning something useful, type the words "left side" in the comments below. It signals YouTube to put this in front of more seniors who need this information. Position number 2. Sleeping with your head completely flat, no elevation at all. Many seniors sleep with their head completely flat on a thin pillow with no elevation of the upper body. This position has 2 specific risks in the aging body. First, it worsens silent nocturnal reflux. Acid from the stomach travels up the esophagus during sleep more easily when there is no gradient. Repeated silent reflux into the airway in seniors is associated with chronic cough, recurrent pneumonia, and worsening sleep apnea. Second, and far less discussed, sleeping completely flat increases intracranial venous pressure. In healthy younger adults, this is a non-issue. But in seniors with high blood pressure, with diabetes, with a history of small vessel disease in the brain, slightly elevated nighttime venous pressure inside the skull may contribute to the slow accumulation of damage in the small white matter vessels of the brain. Damage that, over years, contributes to vascular dementia and is increasingly recognized as a long-term risk factor. The fix is simple. Elevate the head of your bed or your upper body by 4 to 6 inches. This can be done with an adjustable bed, with a wedge pillow, or with sturdy blocks under the head of the bed frame. Avoid stacking pillows behind your head only. That creates the forward neck flexion problem we just discussed. And now, position number 1. The most consistently flagged sleeping position in the medical literature on nighttime cardiovascular events in seniors. The one Walter was sleeping in. The one that, in seniors with one specific co-occurring condition, has been associated with up to a tripling of nighttime stroke risk. Sleeping flat on your back, the supine position. When you have undiagnosed sleep apnea. Now, I need to be very precise here because I do not want to scare anyone unnecessarily. Sleeping on your back is not, by itself, automatically dangerous. Healthy adults can sleep on their backs safely for decades. But for the more than 80% of moderate to severe sleep apnea cases in adults over 60 that are completely undiagnosed, supine sleeping is the single most dangerous body position in the entire night. Here's why. When you sleep on your back, gravity pulls the soft tissue at the back of your throat downward. The tongue settles toward the back of the airway. The airway narrows. In a senior with even mild sleep apnea, this collapses the airway intermittently throughout the night. Breathing stops, sometimes for 10 seconds, sometimes for 30, sometimes longer. Oxygen levels in the blood drop. The brain triggers an emergency stress response. Cortisol spikes. Heart rate jumps. Blood pressure surges, sometimes to levels far above your daytime baseline, for brief moments before breathing resumes. This cycle repeats, sometimes hundreds of times a night. Every cycle is a small cardiovascular crisis. Every cycle deposits stress on aging arteries. Research from Johns Hopkins University has shown that untreated obstructive sleep apnea is associated with up to 3 times the risk of nighttime heart attack and up to 4 times the risk of nighttime stroke in older adults, compared to seniors without apnea. Sleeping in the supine position in those same patients makes the apnea 2 to 3 times worse than in any other position. The combination of unrecognized apnea plus supine sleeping is in the cardiology literature one of the most consistent triggers for the nighttime events we see in adults over 60. The signs of sleep apnea you can identify yourself. Loud chronic snoring. Witness pauses in breathing during sleep, often noticed by a spouse. Waking up gasping. Morning headaches. Daytime fatigue no matter how long you slept. Blood pressure that is difficult to control even with medication. Frequent middle-of-the-night urination. If any of those sound like you, please ask your doctor for a sleep study. Most are now covered by insurance for seniors and can be done at home in your own bed. George was 73. A retired teacher, slept on his back his whole life, snored for 30 years. His wife said it was so loud she had moved to the guest room. He thought it was just his snoring. After a particularly groggy month, his doctor sent him for a sleep study. He had severe obstructive sleep apnea, more than 50 breathing interruptions per hour. He started CPAP therapy. He also began sleeping on his left side. Within 2 months, his morning blood pressure dropped 20 points. His daytime energy returned. His wife moved back into the bedroom. He told me, "I had no idea I had been holding my breath in pieces all night for 30 years. Now, the protective sleeping protocol. Step 1. The default position for seniors. Left side, slightly fetal, with knees slightly bent. This position improves heart efficiency, supports lymphatic drainage, reduces reflux, and minimizes airway collapse. It is the position most recommended in the cardiovascular literature for sleep after 60. Step 2. Head elevation. Use a wedge pillow or an adjustable bed to elevate your upper body by 4 to 6 inches. This reduces reflux, lowers airway collapse risk, and slightly reduces intracranial venous pressure. Step 3. Pillow alignment. Your head, neck, and spine should form a straight line when you lie on your side. The side of your head should sit on the pillow at the same height as the distance from your neck to your shoulder. If you side sleep, a thin pillow between the knees keeps the hips and lower back neutral. Step 4. If you snore, get evaluated. Do not wait. A home sleep study is one of the highest value tests a senior can have done. If apnea is detected, treatment is highly effective and the benefits begin within weeks. Step 5. The tennis ball trick. If you have been told you have positional sleep apnea, or you simply want to stop rolling onto your back at night, sew a tennis ball into the back of a snug pajama top. When you try to roll onto your back, the discomfort gently nudges you back to your side. It sounds absurd. It works. It has been used by sleep specialists for decades. A few red flags that mean see your doctor this week. Waking up gasping or choking, witnessed pauses in breathing, sudden severe headache on waking, one-sided weakness, slurred speech, or facial drooping, which can be signs of stroke and are a true emergency. I want to leave you with this. The position you choose tonight is not a small decision. Multiply it by every night for the rest of your life, and it becomes one of the most consequential cardiovascular habits you have. Most seniors choose their sleeping position by default, by what feels familiar, by what their bodies have always done. After 60, that default deserves a second look. You do not need a new mattress. You do not need an expensive sleep tracker. You need a pillow at the right height, 4 to 6 inches of elevation. Your left side is your default, and an honest conversation with your doctor about whether sleep apnea is part of your picture. If this video gave you something useful, please subscribe. Every week I bring you science-backed, plain language health information for adults over 60, the kind of conversation most doctors don't have time for in a 15-minute appointment. And in the comments below, tell me, which position have you been sleeping in? And are you going to try switching tonight? I read every comment, and your answers shape what I cover next. Take good care of yourselves. I'll see you in the next one.